Gentlemen, let me ask you a question most men over 60 think about but rarely say out loud. Do you wake up feeling like your strength is fading, your energy barely enough to get through the day? Do you notice your performance in intimate moments isn't as reliable as it once was, leaving you frustrated and questioning your vitality? Or perhaps you're avoiding closeness altogether, worried you'll disappoint your partner and lose the connection you both cherish. If any of that resonates, stay with me right now, because what you're experiencing isn't an irreversible part of aging. It's a hidden signal your body is sending, begging for one simple 60-second massage on a specific spot that can reignite circulation, boost nitric oxide, and restore rock-solid potency naturally. I've seen it happen with countless patients, men who thought their best years were gone, suddenly waking up with vitality again. And the best part, no pills, no risky procedures, just your own hands, your own body, and a little consistency. Now, in case we haven't met, I'm Dr. Sophia. I'm a board-certified urologist with over 20 years of experience helping men restore their health and performance. And I can tell you this, what I'm about to share is not hype. It's based on science, medical practice, and proven results. Because here's the truth. What most men blame on aging isn't simply age. It's blood flow slowing down. It's nerves getting compressed. It's muscles in your lower body tightening when they should be relaxed. But here's the good news. Your body already has a built-in reset switch. And by stimulating this overlooked spot, you can restore natural function in ways most men never even hear about. So stay with me because in the next few minutes, I'll show you exactly where this point is, how to massage it the right way, and why just 1 minute a day could change your health and your confidence for good. Let's be honest, gentlemen, things start to change after 60. For many men, what once felt automatic now takes effort. Blood flow isn't as strong, sensitivity fades, confidence slips. Most shrug their shoulders and say, well, I guess that's just aging. But here's what I want you to know. That's not the full story. I see this in my clinic every week. Men in their 60s and 70s who feel embarrassed, frustrated, even hopeless. They come in saying, Doc, I thought this was normal, but it's starting to affect how I feel about myself. And I tell them, it's not just about getting older. It's about what's happening inside the pelvic floor muscles. These muscles are tricky. They control urination, erections, and are supposed to be strong and responsive. But with years of sitting, stress, and hormonal shifts, they become a paradox. Tight and weak at the same time. Like a rubber band stretched too long. It feels tense, but it's lost its snap. That combination slows circulation, compresses nerves, and robs men of natural responses they used to take for granted. The good news is this isn't permanent. It's not a one-way road. There's a solution hidden right in your own body. Once you know how to use it, things can change faster than you might think. So let's dig deeper. Why does this decline happen so suddenly for so many men after 60? First, years of sitting. Think about it. Decades of office chairs, car seats, couches. That constant pressure on the pelvic floor slowly weakens circulation and stiffens muscles. Second, chronic stress. When your body is stuck in fight or flight mode, your muscles tighten, blood vessels constrict, and hormones go out of balance. And guess where a lot of that tension hides? Right in the lower body. Third, hormonal decline. Testosterone naturally dips with age. While normal, it creates the perfect storm when combined with sitting and stress. I'll never forget one patient, Robert, age 68. He walked into my office convinced his best years were behind him. He felt embarrassed, even ashamed, like he had lost a part of himself. But after I explained what was really happening inside his body, his whole perspective shifted because knowledge brings back power. And here's what science shows us. By age 70, nearly 70% of men have some form of pelvic floor dysfunction. Most of them have no idea, they just assume it's age. But here's the truth. This isn't a life sentence, it's a fixable problem. And the key isn't in another prescription bottle. It's in one small area of the body that almost no one talks about. An area so overlooked yet so powerful that even a single minute of attention can start turning things around. Now here's where things get interesting. The very spot most men ignore might actually hold the key to restoring vitality. It's called the perineum. Some traditions call it the $1 million point. Picture the space between the scrotum and the anus right in the middle. Not exactly cocktail party conversation, I know, but anatomically it's like Grand Central Station for male health. Why? Because major blood vessels that feed the penis run right through it. Key nerves that transmit pleasure signals pass across it. The root of the penis anchors there, and it's directly connected to the prostate. When this area gets tight, circulation slows, nerves misfire, and everything downstream begins to weaken. But when you stimulate it the right way, it's like opening a blocked dam. Fresh blood surges back in, nerves decompress, and the body remembers how it's supposed to function. I once had a patient tell me, "Doctor, 1 week of focusing on this spot did more for me than years of trying everything else." And he wasn't alone. Physical therapists use it for pelvic floor rehab. Urologists recommend it quietly for prostate health. And modern clinical research confirms what ancient medicine knew for centuries. This point works. Now here's the part most men never hear. Finding the spot is actually simple, and once you know how to work with it safely, you'll understand why I call it one of the most overlooked keys to male vitality. But knowing where it is only half the story. What really matters is how you touch it and why even 1 minute a day can completely change how your body responds. So let's break down what's really happening inside your body when you massage this point. I like to explain it in simple terms, so you don't need a medical degree to understand. First, think of it like a pump. Each press and release motion pushes stagnant blood out and pulls fresh blood in. That means more oxygen, more nutrients, and faster removal of waste products that slow you down. It's the same principle athletes use to recover their muscles after intense workouts. Second, the nerves. Over the years, tight muscles and poor posture can compress the nerves in this region. And when nerves are squeezed, the signals don't travel clearly. It's like static on an old radio. But gentle massage is like clearing that static. Suddenly the signals, those vital pleasure and performance signals, flow the way they're supposed to. Third, the prostate connection. This point sits right beneath the prostate. When you stimulate circulation here, you indirectly nourish the prostate, reducing inflammation and supporting hormone balance. Many men notice fewer urinary problems, stronger flow, and less nighttime urgency just from this practice alone. And finally, the nervous system reset. This massage activates your parasympathetic nervous system. That's your body's rest and digest mode, the opposite of stress. It lowers cortisol, calms the body, and primes you for natural function. No pill can do all of that at once. And here's the beauty. It only takes 1 minute. 1 minute to improve blood flow. 1 minute to decompress nerves. 1 minute to ease tension and wake up the body's natural response system. But remember, science is only useful if you know how to apply it. So let's talk about the exact technique, because the how, the way you use your fingers, the pressure, the motion, that's what determines whether this becomes a life-changing practice or just another tip you forget by tomorrow. All right, let's get practical. How do you do this safely and effectively? Start seated on a chair's edge or lie on your back with bent knees. This position eases lower back pressure and makes the area accessible. Use your index and middle fingers. Locate the midpoint between the scrotum and anus. Press gently. You'll feel a slightly softer, tender area. That's the spot. Pressure should be like testing a ripe tomato. Firm, but not too hard. This delicate tissue responds best to gentle, steady stimulation. You have a few options. Try small, circular motions. 30 seconds clockwise, then 30 seconds counterclockwise. Alternatively, press and release for 5 seconds each, or use a gentle up and down pulsing rhythm. The best method is personal. Some men prefer one pattern over another. Consistency, not force, is key. The biggest mistake is pressing too hard, like a deep tissue massage. It's not. Too much pressure will leave you sore or discouraged. This is about precision, not brute strength. Think playing an instrument, not lifting weights. Deliberate, careful practice yields results. A patient once said it felt strange at first, but after a week, his body remembered how it's supposed to work. That's exactly it. Blood flow improves, nerves awaken, and tension eases. No equipment, pills, or complicated routines needed. Just your hands and 1 minute a day. The secret most men overlook is that the right oil can elevate your results. It's not just for comfort. It's about oils that improve circulation, reduce inflammation, and boost hormone support. I'll show you which oils work best and why in just a moment. Now, let's discuss oils. While you can massage dry, the right oil supercharges the benefits, a point many men miss. First, castor oil. Used for centuries, modern science now confirms its benefits. Castor oil contains ricinoleic acid, a powerful natural anti-inflammatory. It penetrates deeper than most oils. Combining massage with castor oil, mechanically and chemically, boosts circulation. Many men feel a gentle warmth afterward, indicating increased blood flow. Second, virgin coconut oil, ideal for sensitive skin. It absorbs quickly, is antibacterial, and supports hormone balance. Plus, it smells good, making it practical for many. Sometimes the simplest oils are best. Then there's black seed oil, more exotic and expensive, but incredibly powerful. It contains thymoquinone, which improves circulation and supports testosterone production. Many find it worth the cost. You can also blend oils to create a circulation cocktail. Use castor and coconut oil as a base, then add a few drops of essential oils, peppermint for circulation, rosemary for vitality, sandalwood for reproductive health. Remember, essential oils are potent. Use no more than 3 or 4 drops per ounce. Your choice depends on your body, budget, and preference, but the oil isn't just extra. It's part of the therapy. Massage mechanically wakes the system, while the right oil chemically amplifies the effect. That combination creates real magic. But there's one more crucial factor most men overlook. I'm talking about timing. When you massage is as important as how you do it. So when's the best time to do this? Because trust me, timing makes all the difference. The optimal times to perform this simple routine are first thing in the morning and right before bed, maximizing its physiological impact. In the morning, it primes your body, increasing blood flow and oxygen delivery to kickstart your day with renewed vitality and mental clarity. At night, it helps calm the nervous system, promoting relaxation and preparing your body for a deeper, more restorative sleep cycle. Consistency is far more crucial than intensity. Performing this routine daily, even for just 60 seconds, yields cumulative benefits over time. Remember, building a daily habit, like one patient who started with just 30 seconds, is the key to unlocking lasting improvements in your health. Avoid common pitfalls such as rushing through the movements or neglecting proper form, as this can diminish the routine's effectiveness. The surprising ripple effect of this simple practice extends